And even with that, you think 100,000 deaths is a reasonable projection at this point?
I think, if you look at seasonal flu, we had a bad season in 2017-18. We lost over 60,000 people just in a seasonal flu. This is clearly worse than that. Mm-hmm. So I would not be surprised. I don't want to see it. I'd like to avoid it. But I wouldn't be surprised if we saw 100,000 deaths.
You talked about New York, New Orleans, Detroit. Any other cities you're specifically concerned about this morning?
Hey guys, what up? Total Control 871 chiming in with my latest COVID reporting. Okay, what I just played for you is a bit here from CNN's reporting. This is a couple of days ago, something that Dr. Fauci, yes, the Dr. Fauci, here once again, we see Dr. Fauci reporting that the seasonal flu, hold on a second here. Something is peculiar with my, what is that? Okay, I get a timer on my screen. That's good to know. Seasonal flu. Fauci says it kills 60 to 70,000, per year. And what I couldn't help but notice was, did you not notice how John Berman, the way he very quickly, look at that face. He very quickly pushed past the facts that Fauci was rolling off. Let's have another look at it. Let's have one more time. Let's see.
Blue. This is clearly worse than that. Mm-hmm. So I would not be surprised. I don't want to see it. I'd like to avoid it.
With that, you think 100,000 deaths is a reasonable projection at this point?
I think, if you look at seasonal flu, we had a bad season in 2017-18. We lost over 60,000 people just in a seasonal flu. This is clearly worse than that. Mm-hmm. So I would not be surprised. I don't want to see it. I'd like to avoid it. But I wouldn't be surprised if we saw 100,000 deaths.
You talked about New York.
So there you go. You had, let's hear a little bit more from John.
New Orleans, Detroit. Any other cities you're specifically concerned about this morning?
Okay, so obviously John Berman has absolutely no interest or intention in talking about the tens of thousands, 60,000 people that our seasonal flu kills every single year. Why? Because it does not jive terribly well with the narrative that's out there. That, this is a couple days old now from what I understand, because I don't want you guys to think I'm minimizing anything, but no, this is 1 day ago. We got 2,400 deaths. I'm going to be playing a video for you just shortly. I believe the death toll is up to 3,000. Now, you can believe that as you like. Let's see. You can believe this as you like. Here it is. Cause of death. I could break out my father's death certificate for you. And if I'm not mistaken, I believe it reads on that death certificate that it's natural causes. He was 83 or something like that years old. He had underwent surgery. Now, he underwent, I don't know if any of you guys remember, I give a lot of anecdotal stories and stuff like that on my blog. When I was a little boy, me and my sister, we were little kids, a little, 3-year-old, 4-year-old, climb up on daddy's lap, and he laid out on the porch swing, and passed out drinker. And we'd push his shirt up and we'd be like, Daddy, 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 tell us the story again. The story of the scars on his stomach. That would be from shrapnel, grenade, Korean War. Parts of the shrapnel was still embedded inside my father. Over the decades, eventually it became so, from what's being told to me, painful, irritant. The shrapnel finally now has to come out. I don't know, maybe that's why they did not take it out originally, because it would be too risky. My father was a heavy drinker, an alcoholic. Very little people who knew him would disagree with that. And what that meant is that I'm not a doctor. I can't really give you all that fancy language that doctors will give. I know, is my hood making things too dark now? Is that better, worse? No difference. It makes tissues swell, from what's been explained to me. Tissues swell. My father, his exploratory surgery in his abdomen, the incision could not be closed. They packed it in some fashion. My father's intestines swole up so bad during surgery that they could not close. My father didn't last too long after that, and he ultimately died. What's the cause of death? I don't know. What's trending, teleport back in time if this would have happened. War is unpopular. Would Jane Fonda say it was the war that killed him? Maybe yes, maybe no. If alcohol were to suddenly start trending the way opioid addiction is, and it was alcohol that killed him, okay? So, like I say, the cause of death on these death certificates, the deaths that are being reported as being positive COVID-19, and that the death killed it, I think, what's his name? Wow, that is the first cough of the day. It is 4:48 in the afternoon. That was my first cough. Like I say, I do not cough until I start to talk. Anywho, Joe Diffie is a country singer. They said he had a bunch of hits back in the 90s. They said he died. Not to be disparaging, and God, I'm certainly not one to talk. Yes, I'm forever fighting the camera. Not one to talk, but obese. Very flush, probably a lot of hypertension, high blood pressure, country singer. Is not to go all stereotype on you, but he's probably some alcoholism going on there as well. I don't know if I should maybe open up this window, see if I can create some light coming from this way. Lighten things up. Lighten up. Cause of death. What actually caused you to die? What's actually going to be listed on your death certificate? There are lots of people who go through great pains to not have suicide, but some other thing listed, and it's not always for insurance purposes. Anyway, that's getting way off into a different story. So Fauci is glossing over, excuse me, not Fauci, corporate media is glossing over. They do not want to fixate on the great many people thus far that's being reported. The common flu will kill every year. It doesn't really jive. It's almost like John Berman had to kind of corral and get. Okay, he kind of like looks down. Okay, yeah. Okay, let's talk about Detroit and Louisiana and da. He very quickly pushes past, glosses over, prods, breaks out the old cattle prod, and pushes Fauci along to get him back on message. All right, let's go to our next salacious topic when it comes to COVID-19. Let's see, what are we doing? This is today. This is today's stuff. And let's see what Fauci is talking about today in regards of drug therapy. Now, of course, there was in the news there a couple of weeks ago, some idiot took shit that had chloroquine in it, chloroquine phosphate, stuff you use to clean fish tanks. He and his girlfriend or wife or whatever they were, up and down the gullet or however they administered it, because they wanted to use it as a prophylactic that they don't get COVID-19. And of course, he died. She ended up in fucking critical care. So, hey, I get it. I get it. There are people out there who are doing really, really stupid shit. But let's give a listen to what Fauci has to say about drug therapies right now. Let's just give a listen.
Don't think that you're exempt from not only serious illness, but from the fact that you might be spreading the infection. That's why everybody's got to pitch in. Everybody.
Yeah. Drug therapy treatments, I want to ask about that. Are drugs such as chloroquine, other anti-malaria drugs, is there evidence that they are working, that they're making a difference now?
You know, Jim, I've said that multiple times. When you have drugs that people have anecdotal, not proven clinical studies, people have a need, and it's understandable, of since we don't have anything, let's get it out there. But you have to hearken back to the facts, Jim. There is no definitive evidence that this works. That doesn't mean that people under certain circumstances might use compassionate use. But if you want to get back to the science and you look at the data, you need a controlled trial to be able to definitively say something works. And we have not had that with those drugs.
What the fuck kind of shit is that? Did you understand what he just said? Okay. His own... See, there are so many... Oh my God. You're tripping over your own lies is what's happening. What we're seeing here is that Fauci, he definitely wants to enshrine and preserve big pharmacy's interest in this entire thing. Okay? Fauci's interest is not in saving lives. It's in enshrining precious drug patents for precious big pharmacy, his fucking master, his handler, the person, the entity that's at the other end of his leash. You understand? We hear him talk about it's anecdotal. Well, it's a fluke if some people got relief from COVID-19 from chloroquine. What you need to understand about chloroquine is that it's an already patented drug, meaning that you can't sit there and make money off of somebody else's shit. Fauci is laying the groundwork for a brand new drug, a brand new vaccine that can be patented and that will dispense multi hundreds of billions of dollars. I'm really going to date myself here. I don't think many of you understand exactly how check out my time. I learned I can see time here. Okay, good. I'm at 14 minutes. What I am learning is that flu shot, there we go. Flu shot, it's been in R&D, research and development, for a very, very long time. The flu shot's been around for multiple decades, okay? Harkening all the way back to World War II and probably earlier, the flu shot. Unfortunately, this marvel of modern science, it is, to my knowledge, the only drug that has spent the entirety of its life in R&D, the research and development department, meaning it's never been perfected. They have been trying to solve the common cold and the flu forever, and they haven't gotten any farther. As a matter of fact, and this is just my speculative opinion, I have indeed begun to wonder if these cases, these, was it 60,000 that the flu kills every year, has the flu become so lethal simply for the fact that it has gotten pushback from man-made vaccines? Okay, would the flu be as lethal as it is today if they had not fucked around and tried with a bunch of vaccines? You can't exactly expect the flu virus to just simply sit there with its thumb up its ass and be like, oh well, I guess they got us this year. No need in trying next year. No, the flu is going to continue to mutate and try and try and try, and it's a never-ending war. Like I say, like your going back to my pops, his military service, Korean War. No winner there. You know, you just simply have to draw your line in the sand and strike a truce, you know, and accept your acceptable losses. Same thing with Vietnam, you know, no clear winner. You just simply take your acceptable losses. Fauci, I'm telling you, we also hear him keep pushing, do your part, vaccine. The whole thing does have an eerie mark of the beast type thing to it. Where are my notes? Let me get my notes here. Halfway through my video, probably less than that. Thing's gonna chop me off at a bet 29, I bet. Governor Murphy's crackdown on chloroquine prescriptions. See, this is something that doesn't really jive with our narrative, okay? Fauci over here, he's saying that this stuff it's not really a cure. We don't want you to put your eggs in that basket. You know. If that's the truth, I mean, then why is there a crackdown? You know, Governor Murphy in his public address today said that he is going to be cracking down on pharmacists and doctors writing scripts for their friends and family for chloroquine. This isn't a drug. This isn't an opioid. Okay, this is something that Fauci wants you to believe can't help you. And yet you have the very same people of science, you know, people like our Jim Sciutto and John Berman and all the other corporate media are very eager to tout as being the experts, okay? But they're not an expert when it comes to protecting their loved ones. See, just like Dr. Pinkerton, he talked that good shit, you know, when it comes to denying medication to people who you really don't give a shit about. But when it comes to your own family, then suddenly, okay, it's a whole different story. So Governor Phil Murphy, he is cracking down. Why is there a crackdown? If what this asshole is saying isn't true, you know, if it's true what Fauci is saying, that chloroquine doesn't necessarily fix you, and we might use it for compassionate. What the fuck does that mean? Some deaths are not compassionate, and other deaths are compassionate. You know, we don't want to. Basically, what it means is Fauci is terrified that so much chloroquine will cure, if you want to use that word, will help so many people with COVID-19 that it will create a precedence. That there is no need for his fucking precious vaccine. That we have chloroquine. But of course, he wants to restrict its use. For compassionate use. To be determined. Not by you. By him. Okay, what have I else got down here? Do I want to go into that whole social black and white thing in this video? I got 19 minutes here. the difference in C19 and flu in testing. We have an alleged machine that can crank out results in 15 minutes, they say. It's under development. Also in the whole R&D topic, you got Dyson. They're jumping into the game. We got Ford jumping into the game. All the big auto, they're in the game. Dyson says that they're ready to bang out these ventilators fast and cheap. And then I couldn't help but notice that there was all this talk surrounding it, saying, well, we're going to have to see what the FDA and against more shit, like we got to do testing. And while you're drowning in your lung fluid, he wants to give out testing, and the FDA want to test Dysons. Do you not understand what's going on? The FDA are fucking money whores. They're willing to let you fucking die. They're willing to let you fucking die until a check, big, fat, and lucrative enough, has been written to them to give their fucking rubber stamp okay. Do you dig what the fuck I'm saying? Okay? So if Dyson wants to peddle their ventilator here, ventilators, we need ventilators, we need them fast, oh my god. Oh, but apparently you don't need them so goddamn bad that you won't put them through the rigors. And hey, I get it. I'm not saying that the FDA served no fucking purpose. Obviously, we do need drug regulation. That is some pretty serious shit. But if you are drowning, okay, in your own lung fluid, I don't care if you take a goddamn billows from the fucking fireplace and shove it down their goddamn gullet and start pumping. If they're about to fucking die, then they're about to fucking die, okay? Break out the goddamn Dyson. Recall in antibacterial products. Do you guys remember? Remember I said that you guys, the government banks heavily on you being a second generation CD player type mind, that you can only hold but so much in your mind for so long before you end up doing a core dump to receive more information. Thankfully, I do not have this issue. I keep track of shit. I keep track of shit as it rolls out. Antibacterial products snatched off the shelf about this time last year. Or was it maybe a little longer? Who knows? Point is that long before the COVID-19, disinfectant wipeout, long before that ever happened, antibacterial soaps were quietly taken off the shelf. Now, I don't know if this was done for malevolent or benevolent intentions. I do understand. Science, they come to these realizations all late and wrong. See, do you understand when you use these anti-bac products and these hand sanitizer products, it kills everything. Kind of like a chemotherapy. It kills everything. There's very little targeting. On the surface of your skin, there's good and there's bad. And they're constantly waging war with each other, okay? When you drop your disinfectant bomb by your antibacterial products, what happens is that you kill the good and the bad, and you hope and pray to God that the good shit recovers and comes back and the bad shit doesn't. Either way, when you wound what you did not kill, it's kind of why I tend to be very, very anti-flu vaccine, not your real vaccine, but your anti-flu vaccine. You are just wounding what you can't kill, and it keeps coming back stronger. It harkens back to my points about is this why flu has become so lethal over the decades? That it's in its adaptive measures to survive mankind's onslaught. But yeah, antibacterial products snatched off the shelf. Did that have anything to do with why this COVID-19 is so virulent, spreading so rampantly like this? has mankind's immunity become so dependent? Is it a crutch? Is the flu shot a crutch? Is your hand sanitizer a crutch? How many crutches do you have propping up your immune system? It's another reason why I don't like the thought of forced vaccine. I am very happy with my immune system. I won't get into it, but when I turned 18, I just became extremely healthy. And I'm just going to leave it there. It'll have to be a story for another time. Sports and entertainment, oligarchy, loss of money. I'm at 25 minutes here. We're going to see exactly, don't get me wrong. Fauci's drug patent is going to be a fat payday for the medical oligarchy. However, our Jewish oligarchy and its 5 different starfish arms, by this social distancing, Hollywood is suffering mightily. You can't have your love scenes where everybody, not even love scenes, the touching of the, I swear to God, have you not noticed in television, I have never cupped somebody's face in my life, okay? Never. And I don't think I will. It's just weird. Every show, everything, it's very touching, it's affectionate. It's not even a sexual thing. It could be a parent touching their child. It's all very petting, and it also tends to be very white, which I have another topic here at the bottom. I think I didn't know if I wanted to get into it or not. Social distancing, white versus black. 26 minutes, 27. It's just simply a quantifiable truth. It's something that we black people talk about when white people are not around. White people like to touch each other. They're much more tactile than black people are. Please do not fill the comment section with black people are dying from COVID-19 too. I'm sure that they are. However, if you were to take a do some data. Everybody's collecting data. I'm almost certain, although just like how white people get touchy when you talk about the facts, that they tend to have more of a proclivity for opioid abuse than black people. Things get very touchy. I believe they'll also get very touchy. This thing gonna shut me off at 28? I hope not. I'm just gonna touch you over the whole white people like to touch. Matter of fact, I worked with in my security dealings, because when security responds, casinos, if it is involving white people, this particular supervisor, who was a black woman, she said it to me. I already knew it, but she said it to me. She said to me, why do white people, they like to touch you? When she's like finding out what happened, what the white person will do is they lean in, they touch shoulders, forearms. It's not sexual or gropey, but it's like petting. White people like to pet. And I will give them the benefit of the doubt that it's not necessarily condescending or racist or calling us animals. Is this going to shut me off at 29? If it does shut me off, then we'll just simply call this Total Control 871. I hope it doesn't shut me off. It's about to hit it. But if not, I'm going to keep talking, and hopefully it'll keep going for at least 33, I hope. I got plenty of memory, but I swear I hate the way this thing records. Okay, here we go. Okay, it's still going, wait a minute, it might go 29 and 30 seconds, I don't know. But anyway, I'm not picking on white people. I'm just simply making very valid observations. Black people, they do social distance easier. There's a lot of things about the different races. Black people don't smile. Also, for this thing that shuts me off, I don't know, about to find out. It's not always a good thing for black people. Black birth weight, SIDS, strikes black women and their babies much more than white women. Black people's birth weight tends to be much lower than white people's birth weight. It is no secret. What do you call it? They've done the experiments. A litter of puppies, 2 different litters of puppies. They'll take a litter of puppies, they'll divide them or whatever. Both get fed the same amount of food, but the others will get touched. they'll be allowed to interact with their mother and the others will not. Same amount of food. However, the ones that are allowed to feel the tactile, they grow bigger, healthier. The immune systems are much better. And of course, it's no secret that white people do tend to outlive black people about 10 to 15 years longer than black people. White people are much more tactile than black people. Also, meningitis, I believe the bacterial is the one that's super duper lethal, that kills you with like 24 hours. The outbreaks, it's always in your white college. White people are much more prone to eat and drink behind a stranger that they were just introduced to, just moments ago. Hey, buddy, give me a sip of that. I'm not saying that black people are immune to meningitis. My God, of course they're not immune to it. It's just that the vectors of transmissions are much more less because black people tend to be far more autonomous. We don't touch each other as much. Black mothers, unless the child is crying. I know I'm speaking in very broad things here. And it's not that black mothers don't love their babies. My God, of course not. They love their children, but they might have other children they have to attend to. So unless the child is actually crying and needs immediate attention, then yes, it will be left to sit in its cradle unattended until needed. Stuff like that. I'm at 31, coming up to 32. I hope I shed some light on this stuff. I don't know if this is a hoax or not. I'm not going to drop anchor in the hoax camp, and I'm not going to just be a sheep that, with big anime eyes, is so trusting of people like this guy. I'm watching, I'm questioning, and I am keeping track. I am remembering. I am holding these people to past comments, days gone by, comments of yesterday. Yes, come on, get this together. Comments of yesterday, yesteryear, and yesterdecade. Okay, I'm not going to sit here and just suddenly forget what you've been feeding us thus far. All right, that's it for now. Total Control 871.